New South Wales is facing the biggest challenge we have faced since the pandemic started.
We cannot let this virus take hold.
I need everybody to be shocked. I do expect the situation to worsen.
You can hear the worry in their voices.
This disease will continue to spread and have a tragic consequence.
Millions of people are into a third week of lockdown, and there's little to show for it. The numbers are still climbing.
It's almost impossible for us to get out of lockdown on Friday.
This graph tells the story. The number of people who've been infectious while in the community keeps rising, day in, day out.
We not only have a growing number of cases, we have a growing number who are out and about in the community while infected. And that's both in raw numbers, and it has also been as a percentage of the total cases that contact tracers are finding. So that shows that they're not really ahead of the curve. They've been slipping behind.
It's a while since there's been such a big outbreak in Australia. And the inevitable comparison is with Victoria's second wave. This line shows where Sydney is at right now with the more contagious Delta variant.
This Delta variant is spreading so quickly within households, where once it's in a household, you're going to have another 4 or 5 cases. So we have these huge case numbers.
One of the frustrations is why, despite restrictions and a lockdown, that the numbers keep on going up.
In this outbreak, we've seen 4 key moments. The first was the original incursion event of the limo driver. The second was at Westfield Bondi, where we saw significant spread into the eastern suburbs. The third was when they detected a previously undetected chain of transmission in the inner west to do with a seafood wholesaler in Marrickville. And where we are now is the 4th key moment, which is explosive spread in households in the southwest of Sydney.
Professor Brendan Crabb has given 730 access to new modelling, which uses data from the Victorian second wave to predict the effects of a Delta outbreak, similar to the one in New South Wales, with its enhanced contact tracing capacity.
We're going to need tougher restrictions, something more akin to stage 4 in Victoria, to get this back to zero within a reasonable time frame.
His modelling shows that while current stage 3 restrictions will work, they'll take many months, possibly all the way to Christmas.
Clearly, Sydney at the moment is still in a growth phase. With these new stage 3-like restrictions that came in last Friday, we think that this will go into decline, but it'll go into decline very, very slowly.
What is clear is that the sheer number of new cases points to this outbreak taking a long time to control.
The Crossroads cluster, that bubbled along for 2 months, and the curve took a long time to flatten. It took that long to flatten, and they only reached cases in the 500s or so. Our curve is going to take a lot longer than 2 months to flatten because our case numbers are increasing. We're not having fewer cases each day, it's more and more cases each day. So we're looking months down the track.
But Professor Crabb says that adopting the same restrictions as Victoria did during stage 4 lockdown, such as a better definition of essential workers and essential retail, and more limited travel, could drastically reduce that time.
The good news is that what's happening now is working. What's happening if increased restrictions were adopted and adopted soon would crush this. Stage 4 restrictions will deliver this reduction to less than 5 cases per day on a rolling average within a sort of 4 to 6 week time frame.
Many of Melbourne's restrictions were controversial. Some lacked evidence. Brendan Crabb says we should still implement them all.
We just don't know enough to know about what worked and what didn't work. Some of these things, like mask outdoors and like curfew, might work to influence behaviour as much as they are direct epidemiological tools. So unfortunately at the moment it's still a blunt instrument, and you're better off adopting all of them rather than cherry picking and taking a risk.
The prospect of 4 to 6 weeks of even tougher restrictions before case numbers come down is excruciating. But authorities aren't looking at just case numbers. Their aim is to reduce the number of people infectious in the community to 0.
We're not going after 0 cases. We are going after 0 cases who were in the community while they were infectious. That is the key number.
How long this is going to take depends on your endpoint. It could be less than 5 cases a day on rolling average, and more likely it's going to have something specifically to do with cases they are worried about, meaning cases, infections that occur in the community for which they don't know the origin of. Whatever the case, this is not going to be over within a matter of a week or 2. It's going to take a little bit longer than that. To be precise is impossible at this stage.
There is a perception that New South Wales has dragged its feet when it comes to bringing in new restrictions. But analysis by data journalist Juliette O'Brien shows that Sydney's restrictions came in much sooner than during Victoria's second wave. An initial lockdown was called on day 9 of the Sydney outbreak. By comparison, Melbourne instituted a postcode lockdown on day 35.
There's really no comparison in the timeframes of lockdown. So, for example, I take day 1 as when the first case of the outbreak is notified. And that was very early on in the piece for the Victorian second wave. The stage 4 lockdown was around day 60. For the Sydney outbreak, we went into lockdown light on day 9, and now they have tightened restrictions 2 weeks later on about day 24.
It's pretty pointless to argue about what might have been in New South Wales. The dilemma now is that millions of people are hurting under lockdown, and how to make that as short as possible without losing control of this damned coronavirus.
And what's happened here is New South Wales' capacity to cope with coronavirus has shifted because of Delta. You know, Delta being 2 or 3 times more infectious than anything we've seen in this country before means that the bar has been raised, and it's obviously proven too much for the very good systems that they have there.
Hi, I'm Lee Sales. Thanks for watching this story. If you'd like to watch more of 730's stories, they are on the left of your screen. And tap on the button below to subscribe and get the latest from ABC News.